The number of medical students continuing into general practitioner training has nosedived, contributing to Australia's primary care crisis. To reverse the trend, One Health Group is advocating for an urgent pay boost for trainee doctors to put them on a level playing field with hospital-based GPs. Joining me live is Dr. Karyn Matterson, President of the General Practitioners Registrars Australia. Thanks for your time. So talk us through what's happening here. What's the example of a GP that's entering the GP system versus a GP at a hospital? What are the comparative pay rates you're saying is a problem?
Yeah, so thanks for the question. What we're seeing at the moment is GPs in training are taking basically a haircut when they go into the training, the GP training system. GPRA represents medical students, junior doctors and GPs in training, and our members are telling us that over and over and over again, the detraction from entering general practice is by and large their base rates of pay. So, for example, if a anaesthetic trainee would like to go into general practice, to move over into the training program for GPs, they're taking a pay cut of around about $30,000 in New South Wales. Now, that doesn't mean that that's the case all across Australia, but certainly one of our focuses are attracting and retaining more workforce for the GP community. For patients want to see their GP.
Right. So anaesthesiologists are one of the higher paid ones, though, aren't they? Is there a comparison for an average, for want of a better term, trainee versus a GP trainee, and the difference there? Is that a smaller difference?
The average that the AMA report placed out, I think last year, was around about a 12% decrease.
Okay. And what numbers are we talking about? How much in dollar figures?
I couldn't answer that off the top of my head because those numbers are a little bit opaque across the different states at this point in time. Our submission to the Department of Health and Ageing that we put forward last week, we've made an offer to work with Treasury to try and delve into those figures a little bit more, because our focus is attracting more GPs into the workforce. Our submission will make an immediate improvement in GPs' access for patients.
Right. But if you're saying pay is the problem, you must have a figure. Is it
it's one
one state that you can pluck out? I mean,
Well, I think the Australian reported today that in that particular example it was around about the $30,000 mark. But I mean, what we're interested
what the salary is
patients.
If I understand, I want to get to the patient bit in a moment, but if you're saying the salary really isn't good enough to attract trainee GPs, what is the salary? You must have a figure on it if you're saying the salary is a problem. Yeah,
well, basically the NTCER is the minimum base rates, and they're looking at around about $50,000, $60,000, $70,000 per annum for depending on what stage of training that they're at.
Okay, so you've got trainee GPs starting off on, depending where they're at, on $50,000 a year?
Yes, around about that at this point in time, but that's tied to Medicare. So there's different arrangements in different different practices across Australia.
Okay, I mean, presumably you'll need to flesh out when you're making this submission where exactly these salaries are at and get some more detail from various organisations. Is that the plan?
Correct. Yeah, correct. So, we've just started the work, but we're basically saying that across 3 years of training, the government could offer a supplement to bring GP salaries in line of between $50,000 to $60,000.
So is that you're saying a direct supplement to each trainee GP separate to whatever else is happening in a practice or a Medicare payment, a separate top-up payment? Is that what you're saying?
Yes. Yeah, a supplemental payment across a number of years of their training to attract GPs into the training program delivered by the federal government.
Okay, well, we'll perhaps wait and see what the figures are on pay and what the supplement might be before delving into that at a later point. And what about improving the system for patients? There's a lot of talk around increasing the Medicare payment. If that happens, is the medical profession willing to look at the very declining rates of bulk billing that are happening? Will it be sort of a bit of benefit to doctors that they're making money? That's what happens at the end of the day, but also for patients?
Yeah, well, our interest is really to get in and see patients. I mean, that's what all doctors, I'm a GP myself. I want to get in front of patients and deliver the care that's required. So if we know that GPs in training, we have many part-time GP registrars in training, and the reason that they're part-time is that they need to supplement their salaries because they just can't afford living, like the rest of Australia, can't afford living costs at the moment. So they're going back into different systems, like different hospital systems or looking for other avenues of employment to help supplement their wages. Now, if we could deliver this supplement for registrars, we would expect that we would have more GPs staying in the general practice to see more patients.
Okay. In terms of if the payments at the Medicare payment increase for each appointment, I know there's a lot within that and there's a push for longer payments, for example, to be better incentivised. But what's your view on whether doctors, there's a better benefit for much broader bulk billing, so more clinics doing it? Because I almost see no clinics doing entire bulk billing. Or is it a better use for a doctor to give a slightly bigger rebate to everybody and make it better for everybody to go to the doctor rather than a few, some people getting all free treatment? What's your view on that?
Look, there's so many questions in that question. I think essentially what doctors want to do is deliver care to their patients, and they don't want to see vulnerable patients left out in the cold without care. Now, I think we all, as a society, have a responsibility to ensure that our most vulnerable groups are looked after. Certainly Medicare, it's well publicised, it's in the media every day. The bulk billing rates are down, the Medicare rebate, the patient's rebate is down. Certainly if we did something to lift those, that would have an effect of, again, creating more access to care. What we're seeing with GP registrars is the downward pressure effect of what's happened over many, many years. To answer, Yeah,
just very briefly, sorry, nearly out of time, just finish that thought though.
Sure. Sorry?
Sorry, did you just want to just briefly finish that thought? I know I cut you off, we're nearly out of time, but
Yeah,
sure.
On. Yeah, no worries. Briefly, what we're seeing is essentially less GPs in the pipeline. So that means less GPs to see our patients, and we want to see our patients.
All right, well, this debate is ongoing and taking shape. We'll see what the review says. Dr. Karyn Matterson, thanks for your time.
Thank you.